With all the tender, loving care we give our cats, so many of us overlook an important part of their overall health: oral and dental care. In a perfect world, cats would take care of their own dental hygiene.
Tristan, did you brush today?
But like all creatures who have teeth, proteins, acids, bacteria, and other harmful organisms are at work in your cat's mouth, which can lead to plaque, tartar buildup, tooth decay, painful sores, and, well, you get the picture.
This is a thermoscan, easy way to get the cat's temperature without using a rectal thermometer. We'll be getting a dental scale and polish today.
For the average cat, about 4 to 5 years of age, they will start developing enough calculus where we need to clean their teeth if the owner's not brushing or doing other kinds of dental care at home. And then we come into play because what builds up on their teeth is about the consistency of concrete. See if there's any obvious dental issues. But then listen to their heart and lungs. We're going to do an EKG, make sure we don't have any heart problems. We're going to draw some blood and do some pre-anesthetic blood work. Make sure their organ systems are all working the way they should so we don't have any complications with the anesthetic. The anesthetic we use is very, very safe. However, it is anesthesia. Slide mask over her face, and she's going to breathe this in until she gets very sleepy. We check their teeth every time they come in. For some cats, they will need it every other year. Some cats will need it yearly. Some cats need it twice a year. It really kind of depends on their individual needs. We're going to hook her up on fluids, and that's basically to help maintain the blood pressure, because with any anesthetic agent, even with isoflurane, it's very safe, but it can drop their blood pressure. It also helps to protect their kidneys, make sure we got good blood flow through the kidneys and vital organs while we're doing the procedure.
You see all this tartar and calculus on her teeth? All that brown is what needs to come off.
They all look very good on this one. Smooth, kind of a slick surface so the food doesn't stick to the teeth as readily, which that's part of the problem with them developing calculus. The teeth are rough, which provides a good surface for the bacteria to lay down plaque and collect more debris and that creates the whole process. So when we smooth those down, that the food won't stick to the teeth as readily.
This is just a little head towel to keep her head elevated, and we just dry her face off a little bit. What's up? She said, thank you for the teeth.